Hello, everyone, and welcome to part 2 of Human Impact Partners Power Building for Health Departments webinar series. I'd like to invite everyone to introduce themselves in the chat by sharing their name, pronouns, location, and organizational affiliation. My name is Megan Gaydos, and I use she, her pronouns, and I am the HIP Bridging Program Director. It is an honor to be with all of you today. I'm calling in from the ancestral lands of Mexica and Navajo people, known by many as Mexico City. And I just got signed out of my internet. So I am going to go quickly to that place where I was. There we go. Before we go deeper, I would like to do a broad land and people acknowledgement because our work is spread so far and wide. I would like to acknowledge the many nations on whose traditional territory we are gathering. We acknowledge them as the past, present, and future caretakers of this land. Acknowledgement is one practice towards correcting the stories and practices that erase Indigenous peoples' history and culture. It also reminds us that colonization is an ongoing process, with native lands still occupied due to deceptive and broken treaties. If you don't know whose land you are on right now, I invite you to learn the history and present-day realities of Indigenous people. Claire will share a link to learn about the land you are on currently. As I mentioned, today is part 2 of the 2-part series. Next slide, please. There is closed captioning available. Please see the chat for instructions. Today's slides, recording, and resources, along with those from part 1 last month, will be shared with all of you in the next couple of days. Today's focus is to introduce HIP's new resources for power sharing between government agencies and community power building organizations. These resources were developed by Jesse Corcoran and others at HIP, building on the work we and others have been doing to support collaborations between health agencies and community organizers. Next slide, please. I am so excited that we are joined today by some amazing guests. My colleague and HIP's Director of Communications, Jamie, will briefly introduce each of the 2 sets of resources we have developed. After the first set, we will be joined by Ana Huynh, Program Director of the Mixteco Indígena Community Organizing Project, or MICOP, and Stefanie Hernandez, Health Educator from Santa Barbara County Health Department, who will provide some tangible examples of how their organizations developed relationships, trust, and collaboration over the past couple of years. And then Jamie will introduce set 2. And following that, we'll be joined by organizers Kristian Blackmon, Coalition Coordinator Homes for All St. Louis, and Fidel Chagolla, organizer of Riverside All of Us or None, and Starting Over Inc., who will share their organization's strategies and how they have used power mapping and landscape assessments to address housing and living conditions. Clara will share their bios and websites of our guest speakers in the chat. We encourage you to check them out. We hope to have about 10 minutes at the end for questions and answers, so please throw your questions into the Q&A box. Before turning it over to Jamie, I'd like to note that this webinar series is hopefully just the first of other webinars that we'll be offering in the coming months to encourage and amplify health department organizer collaborations. We want to learn from and work with those of you who are already doing this work and connect with those who are looking to jump in and get started. Please complete the survey that Clara will drop in the chat to let us know if you're interested in connecting. And with that, I'll turn it over to Jamie.
Hi, thank you. Thank you all for joining us today. So I'm going to give a pretty quick overview of these resources. And this is the first set. We put it out a couple of weeks ago. The first set is resources for collaboration and power sharing. And there are 4 chapters. So the intention of this resource is really to guide health departments and other government agencies through the why and how of partnering with community power building organizations to advance health equity. And the 4 guides in this chapter are then built upon in the second set of resources that I'll talk about a little later on. So just for this first set, we're really focused on trust and relationship building and getting really prepared to build external relationships for systems change. You can go to the next slide. So this is chapter 1, the first chapter you'll find in this first set of resources. And here we really explain why health departments should partner with CPBOs and how to build the internal foundations and authentic relationships for partnership. It walks through 4 concrete actions that health departments can take to bring these partnerships to life. And those are giving CPBO partners access to health data and evidence to support their campaigns, creating accountability mechanisms in your health department or government agency, leveraging relationships across government, and also leveraging relationships across the wider nonprofit and funder ecosystem. You can go to the next slide. And also, just before we go into these, so I already said CPBO, and it's a term that's used throughout these resources. And we did want to differentiate in this guide between CPBOs, so community power building organizations, and community building organizations. So community building organizations tend to be service focused, and we're not saying don't partner with community building organizations. There are also many community building organizations that are also community power building organizations. So it's not a dichotomy, but the thing that we're really focused on with CPBOs is their focus on power building, base building, and organizing. So we see base building as kind of the special sauce that makes CPBOs particularly strong partners in these types of collaborations. Services still need to happen, so we're not saying don't partner with CBOs, and again, many organizations will both have a service focus and a base building organizing focus. And you can go to the next slide, Sari. So then chapter 2, the second in this resource, is planning for collaboration. So this helps both government agencies and CPBOs understand the types of collaboration and provides activities to lay the internal groundwork for starting those collaborations. So this resource includes a table of the spectrum of collaboration, from inviting in to working towards actually transforming work and sharing power. And there are specific examples of each type of collaboration in here. We give concrete examples of each type of collaboration. And something we want to remind folks of is it's not a shameful thing at all to be at the inviting stage in part. That's a necessary stage to go through before you get to the point of truly sharing power. So we intend this resource to be used to have internal conversations about what collaboration between your health department or government agency or organization might look like with a community power building organization, and to really get your ducks in a row before taking the next steps. There's an activity involved or in chapter 2 that really walks you through how to assess and plan for collaboration. You can go to the next slide. So chapter 3 is how to conduct a one-to-one. So again, I said this first set is really about the importance of relationship building. And this is one of the key parts of it. So this is a tip sheet that shows you how to approach and set up a one-to-one as a core part of building an internal organizing strategy, and building relationships that are authentic and trusting with community organizers. So what it comes down to always really is like actual relationships with other people. So this tip sheet really goes from everything from scheduling your one-to-ones to like suggested discussion questions, best practices for active listening and relationship building. And I think this, and really all the resources in this set, they're not so, I mean, our intended audience is government agencies and health departments, but all of these resources can really be used by anyone who's interested in building a partnership or collaborative relationship to achieve a change target. So it's not like you could be a community organizer, and the tips in this fact sheet will also be relevant to you. Again, one-to-ones can be a really helpful tool. There are actually some health departments that now use these in their performance evaluations and require a certain number of one-to-ones with community members each year, which we think is a great practice. And you can go to the next slide. This is the last chapter in this set. So chapter 4, sharing organizational charts. This is a really concrete way to share power and sort of demystify the internal hierarchy of an organization. So again, intended audience is folks working in government and departments, and this really walks you through how to understand the hierarchical decision-making structure in a health department and how to share that with potential external partners. So there's an activity to lead you through how to share it, how to walk through your organizational chart, and what key points to cover, and guides you through like explaining and annotating your organizational chart together. and then outlining concrete next steps. So again, just like a concrete way to share power by first just demystifying what the internal power structure at your organization, department, or agency is. And I think, yeah, that's a conclusion of the first set of resources. We'll talk more about the second set of resources that build on what's in here.
Great, thanks so much, Jamie. We'd like to acknowledge that these are brand new resources that are being built on experience from that we at HIP have been having, and others who we've been partnering with have been done, but folks haven't used these resources yet. And so we'd invite you to connect with us if there are comments, questions, or if you'd like to connect about these resources in any way. Clara will be sharing our emails in the chat. And so now I'd like to bring in our first set of panelists, Ana Huynh from Mixteco Indígena Community Organizing Project, or MICOP, and Stefanie Hernandez, health educator at the Santa Barbara County Health Department. Ana and Stefanie are what I'd like to call the second generation of a partnership between the Santa Barbara Health Department and MICOP. I've asked Stefanie and Ana to talk about the history of their partnership, about trust building outcomes of their partnership and their collaboration, and advice for others to help give some context for the Set 1 resources to feel more concrete and grounded. So welcome, Stefanie and Ana. Thank you so much for joining us. Let's begin with Stefanie. Could you briefly describe the origins of your partnership, beginning with cause?
Sure. Can I get my slides up, please? Thank you. You can go ahead and skip the transitions. Thank you for inviting us to this space, Megan. Happy to be here. Always a pleasure to talk to you. So the story of our project began with our now partner, CAUSE. CAUSE stands for Central Coast Alliance United for a Sustainable Economy. CAUSE is well known in Santa Barbara County as a vocal grassroots community organizing group, working with some of the most marginalized communities, including ag workers. In 2016, they published their Farm Worker Bill of Rights, which is exactly as it sounds, a document of proposed rights for ag workers. A key aspect of the document was to establish a successful field bathroom inspection program. So they had approached CAUSE had approached public health with the proposal of the program. Unfortunately, without a mandate from the Board of Supervisors, the creation of the new inspection program wouldn't be possible. So knowing that they needed to make this happen, CAUSE did what they did best and organized their many ag worker constituents, translated the field toilet inspection document used by Monterey County, and had about 60 ag workers complete the assessment in their places of work. So the results of the assessment outlined a clear lack of consistently clean and safe field toilets. So they shared these results with the board. The board then approached public health to look further into the issue. Our public health director knew that data needed to be collected from an impartial source to truly quantify the extent of the problem. At that point, she learned about a pilot project focused on power building that would further explore the issue and build new partnerships. Next slide, please. So the partnership, the pilot project was developed to support power building partnerships between local public health departments and community organizing group. There was a focus on building community power to advance health equity and bring about systems and/or policy change. Our public health director had heard about MICOP from colleagues and wanted to reach out because they were health-based and had partnered with public health and academics before. The director reached out to explore his way to do community-based participatory research because both were taking part in a mutual colleagues course as community partners. The California Endowment had offered a second year of funding with HIP, and so our director wanted to formalize the partnership with MICOP, so she invited them in. By that point, we had already or almost finished the field sanitation project, and we're just about ready to take it to the board. We had invited MICOP to year 2 and pivoted to the Latinx and Indigenous migrant COVID health, or migrant health during the pandemic. So I'll pass it to Megan to share a bit of the PPH context.
Great. Thanks so much, Stefanie. So we're introducing that as as Stefanie mentioned, the relationship with MyCop happened both individually, but also in partnership with the health department's other partnership with CAUSE. When COVID hit, as Stefanie mentioned, there was the Latinx Indigena equity group. The health department at that point, although our formal collaboration with Santa Barbara Health Department and CAUSE had the partnership of PPH had ended, we asked if there was additional TA that could be helpful to continue working with them. And the health department said, yes, it would be great. Could you please facilitate meetings between the health department, CAUSE, and MyCop to have some strategy conversations and continue relationship building between the three organizations. In the summer of 2020, I started facilitating meetings with the explicit goal of trying to build those relationships as newer staff. So Ana was one of the newer staff, Stefanie was one of the newer staff, some other staff. So when we talk about second generation, that's an acknowledgement that like there may be relationships between the first generation of folks who introduce them, but there's also helpful to have intentional relationship building as newer staff get in so that they also have a level of trust and collaboration. And as every organization experiences staff changes, that's a helpful thing to be building in is how are we building those relationships with the newer staff across the organizations and has space for strategy conversations. So now I'm going to turn it over to Ana to share more about MyCop's involvement.
Thank you, Megan, and thank you for the invitation. It's a pleasure to be here representing MyCop. My name is Ana Huynh. Excuse me. I started with MyCop in in August 2020. So when I came in to the organization, one of my first big meetings was meeting with the Public Health Department Director, her team, and the team from CAUSE. What was very helpful about this meeting, even though I was very new, even though the MyCop work in Santa Barbara County was very new, was how intentional this partnership creation, this trust building, this relationship building, how intentional it was and how important it was, because we needed to do a lot of work really fast. So in order to do all this work, in order to just jump in and address those health equity issues, we needed to make sure we could work together. We needed to make sure we could create all the amazing work that we've created, and again, in a really fast-paced environment. With the community that MyCop work with, the community we serve, we need to make sure that the language access was inclusive. And so having these difficult conversations, for example, about just, why isn't COVID information being provided in an Indigenous language, being able to have the setting to be able to ask these questions was absolutely crucial. Again, I was very new. Our organization in Santa Barbara County was very new. So having set times and spaces to address these questions was very good and very helpful.
Thanks so much, Ana. Yeah, you started answering one of our first questions about what helped you build trust with each other as partners. Were there specific things that happened that made you feel comfortable actually as a grassroots community organization and in the same room at the same table with the health department? And vice versa for Stefanie. Either of you can go first.
I can continue on that and then pass it over to Stefanie. Again, for me, being very new and having the responsibility to expanding the work that MyCop has been serving the community for over 20 years in Ventura County, but in a brand new county. For me personally, it was critical that the Public Health Department Director, she was very open, she was very approachable. So she set that example for the rest of her team, which includes Stefanie and other great members that I have been able to just contact directly. With the work that we are doing, we go directly to the community and provide information in their language. And then whatever questions and concerns they have, I could bring them back to the Public Health Department and directly ask, there's this concern, there's this issue, and they would provide us with resources to address those concerns and issues. So that was, again, just having that direct connection and contact directly with the Public Health Department, it was very, very helpful.
Thanks so much, Ana. Stefanie, do you like to share?
Yeah, I'd like to really emphasize what Ana just said. Having that contact was so crucial for both sides, really. I can't tell you how many times I called Ana or Kaz's team last minute's notice. Hey, we just got a supply of tests. Do you need any? Or if we needed to get certain resources translated, we needed to hear what was going on in the community. Are they responding well to this testing site? What needs to change? Is this working well? And so just being able to call Ana on a moment's notice and talk with her directly was really crucial when during the height of the pandemic, things were changing constantly from week to week. And so being able to have that trust in knowing I can just call them up and speak to them was really beneficial.
Thanks so much. I hear the importance of the building of the trust. And I want to acknowledge again, sort of your partnership started initially with like a focus on farm worker health. And in the context of COVID, you pivoted significantly to how are we rapidly accessing COVID information, how are we distributing vaccines, how are we accessing testing and so forth. I'm wondering if there's things that happen also when you're on particularly with your population, primarily Mixteco, Zapoteco, and other Indigenous language speakers. What were some of the things in relationship? Many of those folks may be undocumented, may be experiencing structural vulnerabilities that make it hard for them to navigate systems. Were there other things that the health department did that helped build trust between your members, like sort of you were the liaisons to help your members better access the health department services. Can you talk about how that played out in terms of both relationship building, but also power building? What role did that have in terms of building your membership?
I think the best way I can speak on that is providing two very important examples. One of them is in Santa Barbara County, in North County, there was a huge spike. There was a big surge on COVID infections. And primarily it was because a lot of the farm working community that resides in North County, they were the ones that had the highest rates of infections. Because again, the information wasn't getting to them, the accessibility to testing wasn't getting to them, eventually accessibility to vaccines wasn't getting to them. And the farm working community primarily are those that speak an Indigenous language. So being able to have those conversations, whether it was through the task force with other organizations as well advocating for this, but just seeing the community in general coming together to bring down these infections in North County. So we came in, Michael came in as a resource as well. So the resources that we had with regards to language and that connection and trust with the farm working community, and then the resources the public health department had, joining those combining these resources, we were able to mitigate those infections fairly quickly. I thought we were able to bring awareness, and important awareness, that the Indigenous migrant communities were being just infected the most, were being affected the most. So that is one example. Eventually, because that worked really well, combining all these resources worked really well, we then took those lessons learned and brought them to vaccine clinics. And then we had, again, great collaborations, whether it was vaccine clinics at our office, whether it was vaccine clinics with collaboration with other CBOs, with other organizations. We were able to, again, just target more of the population and ensure that everyone in the community had access to vaccines and information. So one of the biggest takeaways for me is as an organization, as MyCop, we were able to go to the public health department and say, this is the way that we would like to provide a vaccine clinic. And they would just go with it. They would let us lead this event. And it's what really made it successful.
Thanks so much for sharing that example. We have just a couple of minutes left. I'm wondering if we could share some of the outcomes of your collaboration as trust has been built. And Stefanie, I don't know if you want your slides to go back up.
Sure.
Great, thank you.
Yeah, working with MyCop and Kaz has been incredible. Compiling this list together, it's pretty amazing to see all the work that we've been able to do together. Again, a lot of these started off with the COVID pandemic, but we've transitioned to so much more than COVID, and really working on how we can shift power dynamics and work on really addressing these structural inequities. So some of our collaboration efforts include COVID resource videos and flyers translated into various dialects. We had a vaccine town hall that was interpreted in 4 different languages. Our farm worker vaccination clinic that Ana referenced, we invited the Mexican consulate to come in and help answer questions on getting IDs. We had gift bags available for everyone who registered that include PPE, hand sanitizer, and different information on what public health offered as a system. We have contracted with them to provide Indigenous language interpretation at our long-term COVID vaccination clinic location. We worked with them on creating a H2A housing health officer order during the height of the pandemic to make sure that our H2A farm workers were protected. We joined together in the Latinx and Indigenous Migrant COVID-19 Task Force. Next slide, please. We have our power building project, which of course is where we meet with cause and focus directly on upcoming issues, challenges. And through that, we have created a farm worker hotline that we are getting interpreted in Mixteco and hope to provide resources to farm workers who call to the specific line. And we have done a focus, MyCop has done focus groups with farm workers to get key feedback so we can help support these various efforts. We've held vaccination clinics with backpack drives around back to school events. And we are working on a Central Coast Community Health Worker / Promotora capacity building collaborative. And MyCop has joined the Santa Barbara County Public Health Equity Alliance. And then we have also made sure that they continue to get funding to support infrastructure building through our ELC grant project. And I'll just share a couple of the pictures that we've taken. These were at the vaccination clinics, our backpack drives, and at our vaccination clinic that was held at the MyCop office. And Vakasa's team getting vaccinated with farm workers for the first time.
Great. Thank you so much, Stefanie, for sharing these examples. Unfortunately, we're going to have to go back to Jamie to share the next set of resources, but I invite folks, if they have questions for Ana or for Stefanie, to put them in the Q&A, and we'll try to get to them after we finish the presentations. And with that, I'm going to share it back with Jamie.
Thank you. Okay, I'm again going to try to talk through these very quickly, but I do really encourage everyone on this call to click on those links and like dig into these, because there's so much more than what I'm in each of these resources. There's really a lot more than what you're going to get in like a minute from me on each of the chapters. But a quick overview of set 2. So set 2 builds on the pieces in set 1. And this goes really into activities to deepen your power building analysis. So again, it's designed for governmental health departments and agencies to dive into power, what it is, who holds it, and how to leverage and redistribute it to create more equitable and healthy communities. And we touched on this a lot, I think, in the first session of this series. So back in June, on Power 101. Just that because the imbalance of power in our society is the most upstream cause of the inequities we seek to change, it's also the most impactful site for intervention. And also, like, intended audience is when we created these public health departments, government agencies, but these activities can be used by really anyone seeking to change systems. So if you're a community organizer or a community member, really anyone can use these. You can go to the next slide. We'll look at chapter 1. So chapter 1 is assessing your power. So this gives you an introduction to power and offers different definitions and frameworks for thinking about how to wield power to create change. Again, this is going to be very familiar to those of you who were with us for session 1 of this, because last time we talked a lot about different frameworks for understanding power. And it includes an activity to engage government employees and community power building organizations in honest conversations about the distribution of power across the group and the different types of power held by agents in your group. So in other words, it's what kind of power do I or does my organization have? And getting really clear about that before moving to sharing and assessing your power externally. So begin with the internal assessment. There are 2 activities with Jamboard components that you can also do if you're not doing virtually with like butcher paper. And the activities are: how powerful are you, to get your group to think about the power they have as individuals and groups, and identifying your powers to get explicit about the types of power you can hold and leverage for change. Next slide. Chapter 2 is landscape analysis. So this walks you through how to identify and critically analyze the key players and stakeholders in a policy or systems change you're seeking to make in order to advance your goal most effectively. So in other words, it's now we know our power. We did the assessment in the last activity. And this is about identifying the relevant powers and relationships to leverage to make the change that you want to happen. So it's about mapping kind of the ecosystem of your work and pinpointing and identifying who has the power to block or oppose your change goals, who has an interest in your issue, and who can be a powerful ally in your cause. There are also 2 activities in this chapter. One is completing a potential partners and opponents table to identify who can help and who might block the change that you seek to make. And also a landscape web, which is guides you through creating a visual depiction of the relationships between key partners, so you can figure out really where you want to focus your energies. And I can go on to the next chapter, chapter 3. So chapter 3 is all about power mapping, and this, I think, is one of the critical components of all of this work. So this helps you assess the power landscape in regard to the policy change you want to make. And the aim is to help you focus your organizing efforts for the greatest impact. We do want to name that Scope LA, and Claire will put a link to that organization in the chat, is an organization that's been at the forefront of training a lot of organizers on power mapping. This specific power mapping activity isn't their frame, but a lot of organizers we've worked with have been trained on power mapping using their framework. So definitely check out their website. Also, if you're partnering with a community power building organization, it's pretty likely that they're going to be familiar with power mapping. It's a practice that's used and really was developed in movement spaces, community organizing spaces. So it walks you through the process of power mapping, gives you tips for how to troubleshoot common mistakes to avoid in power mapping. And the ultimate outcome is that based on what you map, you can then create a plan for where you want to focus your time and energy. You might do this internally with your coworkers or also externally with collaborators. You can do this as a group. Really, any group aligned around a change target whose values aligned can use power mapping as a tool to figure out next steps in your organizing. And sorry for speed talking, but I will pass it back to Megan.
Hi, everybody. Great. Thanks so much, Jamie. And again, we do encourage you to dive into these materials. This is a speed walk through the many resources that are there. But we are excited to have these resources for health departments to help them understand what grassroots organizers do regularly when working on campaigns and how to use it in your own health department practice or in collaboration with as you're partnering with community organizers to learn in partnership with them. It's sort of giving you some more vocabulary and understanding of some of the core practices. So with that, now it's my great pleasure to introduce Kristian Blackmon from Homes for All St. Louis and Fidel Chagolla from Riverside, All of Us or None, are starting over. We'll share a bit about their organizations and how they use power mapping and landscape analyses in their work as it relates to health equity. Before letting them introduce themselves, I'd like to acknowledge that both Riverside, All of Us or None, and Homes for All St. Louis were also past participants in Power Building Partnerships for Health. We will be sharing a link with that. We'll be doing another round of Power Building Partnerships for Health, where it's an intentional collaboration for 9 months between the health department and organizers, 9 months to a year. with HIP supporting and other organizations supporting relationship building. If you're interested, please contact us afterwards. And that one of the goals of the building organizational partnerships is that the relationships can withstand the staff changes. As you heard, Stefanie and Ana are sort of like the newer generation of staff that are joining. Fidel is also one of the newer staff that are joining after the initial relationships had been built that created the initial foundation. And that's part of the longevity of building relationships. As organizations change, they need to be able to evolve, and that so much begins in the relationship of the organization between individuals, but also the organizational transformation information. So with that, I'd love to welcome all of you and invite Kristian to go first. So please share a little bit about your organization, who you work with, and what strategies does your organization use?
Yes, hello everyone. Good morning or good afternoon to wherever folks are joining from. I'm Kristian Blackmon, Coalition Coordinator with Homes for All St. Louis, based in St. Louis. And also, send some prayers up. We've been experiencing a lot of flash flooding today. We've had a lot of rain, so there's been a lot of flooding and a lot of people that are displaced right now. So just wanted to put that out there. But yeah, so Homes for All St. Louis is a housing justice advocacy organization, grassroots organization. We started in 2018 and just got staffed in 2020. So we're a small but mighty team. But the work that we do, essentially a couple things. One, rapid response and direct response. So we have a housing hotline, so folks can reach out to us. We have a 24-hour hotline, and folks can reach out to us for something as simple as like, hey, my landlord hasn't fixed this hole in my wall, to, hey, I'm actually about to get evicted. So for us, we provide or at least direct people to resources, what those resources may be. A lot of times it's legal support that folks need. Sometimes it's something like, hey, I have some questions about my leasing agreement. There's some things I'm confused about. To us actually doing direct action, showing up to properties where folks may be experiencing illegal evictions or illegal lockouts. And also, again, we've also helped folks, particularly since the pandemic has started. There has been a lot, I'm sure for folks that don't know, I'm sure a lot do know, there's a lot of folks that are now facing much more housing instability and insecurity due to the pandemic. So we've experienced a lot more people that are facing displacement, illegal evictions. Their landlords may be selling the property, pushing out old tenants to bring in new tenants. A lot of folks that we've seen are experiencing being priced out due to a lot of it's not unique to St. Louis, but a lot of gentrification, a lot of new developments that are causing a lot of folks that have been living in properties a number of years, and particularly a lot of times we see seniors experiencing this, are getting pushed out of their homes or priced out of their homes. So that's one piece. Another piece is being able to assist people in organizing. So if they are experiencing injustices or experiencing things with landlords that are not showing up and are not maintaining the property as they should, we assist folks in organizing around what that is. A lot of times it's just maintenance issues. You know, I've had this same leaky roof, or this hole in my wall, or the AC isn't working properly, the heating isn't working properly. So being able to help people and assist people around organizing around that. A two campaigns right now that we're working on. One is to pass a tenant bill of rights. So that's kind of where the health department is something that we were looking to as it pertains to that. So that's a tenant bill of rights. A tenant bill of rights has been passed in other parts of the country. In Missouri, there are some protections for tenants, but there's a lot that aren't protected. So for example, a couple things that we've thought about, for one, around just right to counsel. So if folks have to go to court around housing, eviction, whatever that may be, that they have the right to have legal representation. Something like, if someone has had prior evictions on their record, that isn't counted against them when they're trying to find somewhere else new to live. A lot of times folks, they may have the money, they may have a better job, they may have the income, but unfortunately they may have past evictions on their record, and it hinders them from being able to find new properties. Also looking at if someone is having to be displaced, not due to their own accord. So if a landlord is now wanting to rehab the building, or now they're saying, hey, I'm about to sell my building, that there can be a relocation fee or stipend that a tenant has to be able to move, because sometimes folks don't have first and last month's rent to be able to move, say, within a few weeks. So just throwing out a couple things that we thought about around like tenant protections. And lastly, around the organizing piece. So us being able to assist tenants in forming tenant unions, so that they are able to maintain and make sure that where they live is equitable, is safe, is affordable. So that's a couple pieces around like what Homes for All does. And am I still good on jumping to the power piece, or should I pause?
We're going to pause for a second and let Fidel introduce his organization. And so, Fidel, if you could do that succinctly, that would be awesome, so we can get some time into it. So please tell us a little bit about starting over, Riverside or none, and then we'll jump into power building and power mapping.
Okay, thank you, Megan. Hello, everyone. My name is Fidel Chagolla. I'm an organizer for Starting Over, and I work for Riverside All of Us or None, which is a national grassroots organization led by justice impacted folks and impacted folks. And what we do is we work towards civic engagement, advocacy work for those returning home. Also at Starting Over, we provide transitional housing. We have 8 homes in Riverside County and throughout LA County, a total of 8. We provide family reunification services for people that are trying to get their children back and stuff like that. We assist them with helping them create a living biography, so that way they have something other than what the courts are trying to say they are. So that way, we bring that human person back, and we walk them through that process, so that way they could get their children back. Also, we have at our home locations, we have case management, peer support. We also have funding right now for this rapid rehouse project, which helps those that have been justice impacted get housing. We will pay their 2 months rent as long as they're working. They get a 1 lease contract. So we work on a variety of different things. We have like a wraparound services at our locations. We also provide COVID testing kits and sanitizer and stuff like that when we go out there into the communities. We do a lot of outreaching with the unhoused population as well, providing some services. Sometimes we have clothing and stuff like that, lunches and stuff like that. We just did a community barbecue, which was at Fairmont Park. A lot of people showed up, so that was really amazing work. And right now we're working on a backpack giveaway, and we're providing 500 kids with backpack with school supplies and tickets to Castle Park in Riverside County. That's going to be on August 6th at Castle Park, and we're going to have some music there and then some games and activities for the kids. We also did our Peace and Justice Summit in April, which focused on reentry services, on having public defenders there, the DAs there. We tried to get probation and parole there, but they didn't show up. Public health was there to talk about, the barriers that exist for people returning back home. And we had panelists up there. It was a great event. A lot of people showed up to bring more awareness into the communities about the struggles and how housing becomes an issue, and it's going to continue coming an issue as well.
Great. Thanks so much, Fidel. And so one thing I'd like to lift up with both of your organizations, both of you are doing, you're doing organizing and base building as part of the work that you do, but you're also doing these other services like direct service delivery, helping with legal advocacy, helping with case management and so forth. And so again, lifting up why are community organizers a good partner for health departments. You guys are very, very closely working with impacted communities, folks facing eviction, formerly incarcerated, folks that are justice involved system, folks that are experiencing housing and insecurity, economic insecurity, and so forth. So I want to lift up like Thanks so much for doing the work that you guys are doing. And now we'd like to pivot also to talk about power mapping, since that's one of the other resources that we have in the toolkit, and to ask about how have you used power mapping in your work? So if you could share in just a couple minutes, how have you used power mapping in your work, and what tips might you have for others who are planning to do power mapping? Maybe we'll have Kristian go first.
Yeah, so for us, we power map often, like anytime you're thinking about a campaign or work that you're trying to take on, power mapping is a part of it. And so for us, really quickly, as we think about power is in doing our work, is our organized folks, our organized community, and organizing those resources, recognizing that a lot of folks in our community oftentimes don't feel like they have any power, to be honest, due to all of the systems, oppressive things, life experiences and challenges that they have. So oftentimes we're going into communities with our people who feel like they don't have power, feel like they don't know where to start. So getting them to see that we do have power, and what that power looks like, and how do we combat entities sometimes and folks that are in these positions to make decisions. So for us, it's really thinking about a couple different pieces to that. So whatever the issue may be. So for instance, us thinking about a tenant bill of rights currently right now. So we've been doing a lot of power mapping. So thinking about who are the power players. So one, who are elected officials, those who actually, when we put the bill in front of them, who is going to be voting on this. So looking at that. So looking at so with power, in the power mapping, thinking about who's neutral in this. So who doesn't really have a stake or hasn't really made a position on something, who is for that issue, right? So who has been vocal or at least told us, hey, I'm going to support this. How can I help in supporting this? And then of course, the other side is just the clear opposition to that. So who are folks, or who's that entity or person who is like, I'm not for this, I don't support it. So how are we going about that? And also recognizing sometimes having to look at what power mapping is like, where relationships lie. So who has relationships with different folks that can lead to, that can be helpful or that could be harmful, right? Who can be an ally in something. So in thinking about a health department, for example, and tenant bill of rights specifically, so our thought is oftentimes, people think about it, but I think a lot of times people don't think about the connection between housing and health. So having, equitable housing, having safe housing, and safe being the actual structure of the building, the neighborhood of the building, your neighbors. Oftentimes not thinking, a lot of times, even with landlords, sometimes people feel unsafe because they may be renting from someone who uses predatory practices in the way in which they rent to their tenants, right? So with the health department, so if it is like, hey, we need some testimony, we need someone who works in these particular fields to speak to how these things in housing, so if a building isn't up to code, if you're having someone who's constantly having code violations, if thinking about, okay, is there mold in the home? Thinking about how's the heat and cooling in the home? Thinking about all of these different pieces, right? The health department, with all of its different entities, has ways to, also give, facts and data that connects our community-based, the stuff that we're saying and talking to community about. Because oftentimes when we go in front of these, particularly in the political realm, sometimes, even though we can give all the testimony, people can share their stories, sometimes they still want data to match what we're saying, right? So being able to have an entity like the health department to be able to, basically kind of follow up and say, actually this is true. These things are in connection to each other. So in doing power mapping, we look at, who is with us, who isn't with us, who's neutral, and if they are neutral, what can we do with that so that they can be potentially someone that we can bring to be an ally in our work. So I think the Tenant Bill of Rights is a good thing for right now to share around why we power map. And like I said, we do this for pretty much everything. And sometimes you may go into something thinking that it's going to go a particular way. You do the power mapping and then you realize you were totally off base, because sometimes you may realize a new relationship of something, or I actually didn't know that they were connected. For us really quickly, as far as landlords, sometimes you may have elected officials or people in different positions that actually are, homeowners and they may rent, they may be landlords, they may be property owners. So they may have they may not, but oftentimes that means that they have a different perspective as it pertains to tenant landlord issues. So different things like that is important when we do the power mapping. And that is something that we typically do internally within the organization. And that is a way for us to go about how do we jumpstart a campaign, how it gauges how we do the work from start to finish.
Great. Thank you so much, Kristian. I think it's so important for health departments to just sort of like power is at play at all the time. Like there's always power dynamics happening with elected officials, particularly with health departments, but we often see ourselves as power neutral or like not having power when we're in health departments. But I think one of the things I want to lift up what you're saying is like power is always at play, and it's really important to be explicit about power. Like when you're thinking about a tenant bill of rights, are they in favor? Are they not? How do we shift them to be in favor? Or how do we neutralize the opposition or like limit their ability to oppose the bill? How do we move those who are neutral, et cetera? So thank you so much for sort of like giving the tenant bills rights. Fidel, quickly, I know we're getting close to our end of time, but is there an example that you'd like to share of like how have you used power mapping or landscape analysis in your work?
Okay, thank you, Megan. I see it like we see what's the problem in the community, and then we try to focus on that, and we see like, okay, can we gather people together? So with the power mapping, it gives us a idea of how identifying who has the power in the community, begin strategizing what will move those individuals or institutions to assist in the success of campaigns and strategies with whom our ecosystem can influence them, and develop data to process a power mapping effort. And the thing about it is like public health they might have a connection with elected officials that we don't have. So then by us collaborating, they're able to make that connection and get us that meeting that can help us with whatever we are working on at the time. So like, for example, right now we're working on AB 1869 backfill money, and we're doing a power map on that because we're having a difficult time getting that money that's getting redistributed to the county level to be used for reentry services. It's going towards public safety. So we're power mapping around that, and we're trying to strategize and think like, okay, well, who has these connections that are in public health? So that way we could utilize our relationships that we already have and that we have developed, so that way we could work towards ultimate goal, and that's redistributing the money that's coming to the county level for reentry services.
Thank you so much, Fidel. Yeah, that's a great example. And I know often in some other places, it's been actually the reverse, where the organizers have relationships with the elected officials, and they're helping broker relationships between the health department and the elected officials to be able to contribute, whereas in the past it hasn't. So acknowledging it goes both ways, and that relationship building between the health department and the organizers can help amplify the network. And as you said, Fidel, the ecosystem of like, who are all the factors? If we're really trying to get better conditions for our folks that are disproportionately impacted by inequities, how can the health department help leverage their relationships, their power, whether they have internal power, external power relationships, and so forth. Thank you so much for sharing those pieces. I think we're getting, unfortunately, we ideally would have had this be an hour and a half. We didn't plan enough time, so I apologize. We're not having enough time to really dive in deeply into these conversations, but I would like to, at this point, invite the other two panelists to join us and check in about sort of like the question and answers. I feel there's a number of different questions that we have in the chat that we have. One of the ones that we also had, it was, what recommendations do you have? And anybody can feel free to answer this. For as community organizers, as community groups that are wanting to work with health departments, or as a health department that has worked with organizers, what advice do you have for for health departments that are wanting to engage with you? If you have like one piece of advice, if you could share that, what recommendation would you do for starting to build relationships with the organizers in their community?
I can get us started. So I think the biggest takeaway for me is you can only move at the speed of trust. Taking the time to really get to know each other, know each other's work, and really understand what power you have and each organization have, and how can you leverage that. We in governmental public health have a vital role in shifting that power. And although it may not always feel like it, we are uniquely situated and have the power to contend with oppressive practices and advance health equity.
Thanks so much, Stefanie. Does anybody else want to chime in? Fidel, Ana, or Kristian?
Okay. I think health departments should aim to become actively involved in establishing those relationships and then following up. It could be at an event, it could be just to get that relationship started, so that way, they could see the work that we do, we can get to know each other, and they can provide information for our people that need the information, just to show that they're actively involved with us in the community.
Thanks. Kristian or Ana, or should we move on to the next? Okay, we'll move on. So we had a question from Isabel. How did the Public Health Department plan for this partnership and engagement? What were the funding and staffing decisions that were made to support this great work? Stefanie, I don't know if you want to take a stab at this. Again, I'll acknowledge sort of an initial seeds of this was through Power Building Partnerships for Health that helped create some space and intentional space and time for relationship building. But there had already been some initial relationships before. And following the PPH project, there became much greater investments in the ways that the health department and I believe MyCop also how you've been dedicating some staff time.
Yeah, absolutely. It definitely started with this key partnership. It got us in the same regular spaces together. And so we began talking back and forth. And because of the pandemic, there were a lot of really great new funding sources for public health. And so being able to utilize those to create our Office of Health Equity, get a health equity coordinator, so that the director wasn't the only one responsible for managing these partnerships. She definitely got the work started, but through the Office of Health Equity, we are now able to have dedicated staff to be able to work directly with community partners and various community leaders to make sure that the work continues beyond COVID and beyond these one or two individual grants.
Great, thanks so much, Stefanie. Ana?
Yeah, I would just add also, yes, it's been very helpful that Public Health Department has been able to get funded directly for these services, but also through our partnership, we have opened up opportunities to fundraise for other opportunities as well. So there's that great benefit that funders really like seeing those partnerships and collaboration and want to invest in ensuring that those flourish. And also, yes, just MyCop is financially able to provide in-kind staff support as well.
Thank you so much. There was one other question about what would you say the depth of partnership between a health department of health, public health and CPBO is unusual? Has this increased during COVID? I'll answer that really quickly. Again, CPBO is a community power building organization. In our resources, we differentiate how that's unique from community-based organizations. There's sort of like a Venn diagram. CPBOs can be CBOs also, as you heard from Kristian, Fidel, Ana. Their organizations do power building, but they also and base building with their members, but they also do other types of service delivery. They do legal advocacy, they do case management, they do many different other types of work. And this project and collaboration between the two has helped each organization do their work even more efficiently and smoother between the communication. In terms of how unusual this is the point of what we're trying to do as human impact partners is they are not that common, and we want them to be more common because we actually think that if we're going to be addressing health inequities, we need to be having more tight relationships with those who are on the outside of government, people who are able to sort of pressure and organize and mobilize a base to push government to be doing the more equitable decisions, to be really accountable to those communities that are experiencing inequity. We have seen that there's more collaborations happening as a result of COVID, but the ones that have flourished more were the ones who had relationships prior to COVID, and that this relationship has enabled them to continue doing that. Unfortunately, we're at time. If you could throw up the last slide, I want to say thank you so much to each of our presenters. I encourage each of you who are listening to please email them if you have additional questions. We want to encourage you to stay connected with us. We will be sending out the slides from both this presentation and the recording from this presentation and the previous one, as well as all the resources and links. The last thing I'll mention is that we really want to encourage folks to complete this power building landscape assessment. We're in the process of trying to identify health departments who are already doing this work to connect with you to better understand what is the landscape, what is the work that we need to do collectively, and to support other organizations or health departments that are wanting to do more of this outreach and connection. So please do that if you want to stay in touch with us and get additional resources. We want to thank all of you for participating on this webinar. We're excited to see how much growing interest there is in power building and look forward to connecting with you. We want to do a final thank you to our amazing guest speakers, Ana, Stefanie, Kristian, and Fidel. Thank you for the power building and the trust building you're doing, and for sharing your stories today. I also want to thank Jamie for presenting, thank HIP staff, Sari, Jesse, and Clara, who helped behind the scenes, and give a special thanks to our colleague Julian, who helped organize both of these webinars. Please do follow up with us if you have any other questions. Our goal is to support health departments and community power building organizations working together. Please help us understand what's helpful, give us feedback. We hope to be again in touch soon, and we hope you have a great rest of your day. Thank you so much.